We are still watching this major conversation taking place on the Senate floor when it comes to your health care. Will lawmakers decide to extend the Affordable Care Act tax subsidies, or will those expire by the end of the year? Today, we're looking at dueling, two different proposals, one by Republicans, one by Democrats, very different when it comes to how to deal with this issue of those expiring tax subsidies. And we just heard from Democratic Senator Chuck Schumer, and then also on the Republican side, the Republican leader John Thune. So we're going to go ahead and play those shots back to back here so you can hear their position, and then we'll come back into this discussion live on the floor.
The Democratic leader.
I ask unanimous consent the quorum be dispensed with.
With that objection.
Mr. President, today is D-Day, Decision Day for Republican senators. Will Republicans side today with the American people and avert the impending health care crisis, or will they abandon American families as premiums shoot through the roof on January 1st? That is the decision Senate Republicans must make today. I say to my Republican colleagues, our bill is the last train to leave the station. After wasting precious time fighting among themselves, Republicans have one last shot at a clean, realistic plan to lower health care premiums. The Democratic bill is the only bill that will do that today. Ours is the only bill on either side in the House and Senate that has the full support of every member on our side of the aisle. Democrats are fighting to lower health care costs for the American people, while Republicans are fighting among themselves. By my last count, Republicans are now at 9 different health care proposals and counting, and none of them give the American people the one thing they most want: a clean, simple extension of these health care tax credits. But our bill does extend these credits cleanly and simply, and it's time for Republicans to join us. So I repeat, our bill is the last train to leave the station. After this, we'll not have time to try again before premiums shoot through the roof next year. This is not a political fight. This is not a symbolic vote. This is a life and death vote, because people who will lose their health care could face that horrible, horrible end. This is about ensuring that working and middle-class people can afford to see a doctor without going broke, to afford a treatment for illnesses like cancer, and enjoy the dignity of good health without wiping out their life savings. For many Americans, affording health insurance is the difference between life and death, as I've said. So we must act. People are counting on us. The American people are counting on us, counting on you, Republican senators, to act. Now, of course, this morning, the Senate will first vote on the Republican health care proposal. But the Republican plan is nothing more than a reflection of the deep divisions inside the Republican caucus and the Republican Party. Republicans have had so many differences amongst themselves that for a while it looked like they weren't going to put up a bill at all. But after that became too embarrassing an option for Republicans, they used Scotch tape and glue to come up with this ridiculous proposal that can't be taken seriously and does nothing to avoid the impending health care crisis. It doesn't extend the ACA tax credits for a day, a month, a year, none of that, not even a day. Even calling this Republican bill a proposal is generous, because the Republican bill is little more than junk insurance. It is no real plan at all. It's been repudiated time and time again in the past. and will be repudiated by the American people again. Under the Republican plan, the big idea is essentially to hand people about $80 a month and wish them good luck. And even to qualify for that check, listen to how bad this is. Americans would be forced onto bare-bone bronze plans with sky-high deductibles, $7,000 or $10,000 for an individual, tens of thousands for a couple. So to get that $80 a month, you're going to pay $7,000 off the top before you even get any health insurance. How ridiculous, how stingy, and how mean and cruel to the American people. What Republicans offer is not a health care plan. The Republican plan is a when you get sick, you go broke plan. And you know, it's sad the Senate even got to this place to begin with. Republicans in the Senate should have solved this problem months ago. Democrats warned this crisis was coming. We gave Republicans more than 3 chances to extend the tax credits this year, in the spring, the summer, and the fall, and every time, Republicans said no. Instead of lowering premiums, Republicans chose instead to axe health care funding, kick millions off insurance, close rural hospitals, all the while ripping away nutrition funding for working people. Why? So they could give their billionaire buddies a tax break. And now, after so much delay, Republicans are about to let the clock hit midnight. So there's only one option left to avoid falling over this health care cliff that Republicans have brought us to: a clean, simple, direct extension of the current ACA credits. Every single Democrat is unified behind this proposal. I urge Republicans to drop their divisions and join us. Republicans, join us and let's avert a disaster. Join us and let's lower costs for the American people. We have one shot to get this right. Republicans, join us. The American people are watching how Republicans vote today. On the nomination package, today Senate Republicans will move forward with.
Okay, you were just listening to Democrat Chuck Schumer there in the Senate, the minority leader. So now let's hear from the majority leader, Republican John Thune. Again, we're talking about this very big conversation taking place right now in the Senate on whether or not they should extend the Affordable Care Act tax credits. And so we'll hear from the Republican majority leader now.
Majority Leader.
Thank you, Mr. President. Mr. President, later today, we will vote on the Democrats' partisan messaging bill, which is a clean 3-year extension of the Biden COVID bonuses. And when I say clean, I mean all that I mean by that is no reforms, straight up extension, 3 years of a program without any reforms, any revisions, any changes that would actually help drive down healthcare costs instead of increasing healthcare costs and get rid of the rampant waste, fraud, and abuse in this program. The Democrats' plan that the Democrat leader called it on the floor the other day, it's their plan. Apparently, they think that a 3-year extension with no reforms to try and disguise the real impact of Obamacare's spiraling costs is actually a plan. I don't know how you can call it a plan. I came down here yesterday, Mr. President, to talk at length about some of the many problems with Obamacare and the perverse incentives it provides to move employees off of employer-provided insurance and into taxpayer-subsidized plans that have rampant year-over-year increases in premiums. The perverse incentives that it provides to insurance companies to enroll Americans, some of whom don't even know that they've been enrolled, so that the insurance companies can rake in even more subsidies. And then this so-called plan is rampant, and I say rampant, with fraud and abuse. Mr. President, a Government Accountability Office report released just last week found a whole host of problems, including the successful enrollment of fake individuals, Social Security number fraud, failure to verify or sometimes even request documentation, improper payment of subsidies, and the list goes on. And I want you to just take a look at this. This is the finding that came out of that study that was done by the Government Accountability Office, Mr. President. And here was the conclusion. Obamacare subsidies granted without documentation to 90% of fake accounts set up by a government watchdog. 90%, not 10%, not 5%. I mean, if you had a program that had 10% fraud in it, I think that would be a huge red flag, right? Wouldn't you be alarmed by that? I think most people would. I think most people would go, wow, that's a huge number. We need to do something to fix that. This program that we're talking about today, that they want to do a straight-up extension on, no reforms, no revisions, was found by the Government Accountability Office, an entity and agency that Democrats love and support, found that 90% of the accounts that were set up in the Obamacare exchanges were fake. Fake. Think about that. My aching back, Mr. President. This, you can't make this stuff up. We're talking about tens of billions of dollars in waste, fraud, and abuse on a yearly basis. And they don't want to do anything about it. They just want to straight up extend a program that the Government Accountability Office says has a 90% fraud rate. Well, Mr. President, that's obviously a huge problem, but I haven't even gotten to the central problem. And that is that Obamacare has utterly failed to control health care costs. Since 2013, Obamacare enrollees have seen a 221% increase in premiums. Now, let me just repeat that, Mr. President. Since 2013, Obamacare enrollees have seen a 221% increase in premiums. 221%. That means Obamacare premiums have grown at approximately 5 times the rate of inflation. So much for making health care more affordable. Now, Mr. President, this graph, I think, illustrates that, and actually this understates the problem because this shows since 2014. In the first year of its inception, when the Obama exchanges went live, there was a huge increase that the insurance companies built in their premium cost to cover all the things that they had to cover in the new program. So since 2013, that number is 221%. But even since 2014, when the exchanges were fully up and operating, it's had a 129% increase in premiums at the same time that the group market, in other words, the large and small group market where a lot of people get their insurance coverage through their employer, was going up at about half that rate, 68% in the small and large group market, which is where about 150 million people get their insurance. And frankly, the more people we could push into that market, it will not only lower their costs, but it also spreads the risk among a bigger pool. And that ultimately is the way in the long term you want to spread your costs. But what Obamacare does, because it uses taxpayer dollars to subsidize and pay insurance companies directly. Premiums go directly to the insurance companies. So insurance companies are making bank. They're getting enriched by this. But what it does at the same time is there's no incentive to control costs. And it's pushing people into that market. Because if you're an employer, or an employee for that matter, because most people respond to incentives, and you are told that you can get into a market where the taxpayers are going to cover it, and the employer is going to say, well, why should I continue to pay for the health insurance coverage for my employees if I can have the taxpayers pay for it? And so it's pushing more and more people out of the group market, this market right here, where there's a 68% increase, still way too much over the last decade. They're pushing more and more people out of that market into this market, which is double the rate of increase in premiums, and that doesn't include, as I said, the first year in its inception. If you add that first year back in there, that number is 221%. So you've got this system that is pushing more and more people into insurance coverage where the rates are skyrocketing, where the payments are going directly to the insurance companies, and where lower income taxpayers are subsidizing higher income taxpayers because there are no income limits. So now you can have people making $500,000, $600,000 a year are getting subsidized by the federal taxpayer, people making $40,000 or $50,000 a year, at a cost to the federal taxpayer in their bill alone, which is just a 3-year extension, of $83 billion. You tell me in what universe that makes sense. That's astonishing. To have a program where 90% of the people who were fraudulently enrolled got approved. A program where the rate of increase is twice the rate in the group market and 3 times the rate of inflation, the consumer price index, over the same time period. And the insurance companies are getting rich. Lower income taxpayers are footing the bill so more affluent Americans can have coverage. And the American taxpayer is paying $83 billion just for the 3-year extension. Waste, fraud, and abuse, higher rates, fiscally irresponsible, and the list goes on. Well, Mr. President, even Democrats have to be well aware of the fact that Obamacare has utterly failed to do what it promised. As I mentioned yesterday, we had one Democrat senator come down to the floor during the shutdown, and to his credit, he admitted the truth, and this is what he said. He said, "We did fail to bring down the cost of health care," it's a direct quote. We did fail to bring down the cost of health care. So what are Democrats proposing to do about that failure? As I said, exactly nothing. Democrats' so-called plan is a 3-year extension of the status quo. No reforms, no revisions, no rethinking of the way that Obamacare works, just a 3-year extension of the status quo, which I might add was put in place in response to the pandemic. When they extended these subsidies back in 2022, it was in August, the pandemic was long over. Long over. You can't, as I said, you can't make this stuff up. So we're not going to do anything to address the perverse incentives that push Americans out of the employer-sponsored health care system and onto taxpayer-subsidized plans. It's not going to do anything to address the perverse incentives that encourage insurance companies to enrich themselves at taxpayer expense. It's going to do nothing to address the rampant waste, fraud, and abuse in Obamacare. And most of all, Mr. President, it will do nothing to bring down health care costs. Nothing. Zero. Now, under Democrats' plan, insurance premiums will continue to spiral. American taxpayers will find themselves on the hook for ever-increasing subsidy payments. And don't think that all those payments are going to be going to vulnerable Americans. As I said, the Democrats' decision to remove any income cap on the Biden COVID bonuses has Americans making as much as $500,000 or more qualifying for taxpayer subsidies. $500,000. Do Democrats really think middle-class families should be subsidizing health care premiums for those making $500,000? Mr. President, Democrats don't have a health care plan. They don't extend the status quo. A failed, flawed, fraud program that is increasing costs 3 times the rate of inflation. Now, on the other hand, Mr. President, Republicans today will offer something that does actually lower costs. Earlier this week, we introduced legislation drafted by the chairman of the relevant committee, Senators Crapo and Cassidy, to make structural reforms to the individual health insurance market. In contrast to the Democrat bill, our bill would actually lower, as I said, Obamacare premium costs, and it would redirect government savings from the bill into health savings accounts for eligible Obamacare enrollees earning less than 700% of the federal poverty level, paired with some affordable insurance plans. These accounts would help individuals to meet their out-of-pocket costs, and for many individuals who don't use their insurance, who barely use it, it would allow them to save for health care expenses down the road. So we have two paths here, Mr. President. One, a plan to start addressing the spiraling health care costs in Obamacare and make structural reforms that would drive down premium prices. Two, a proposal for a 3-year extension of the status quo. So you tell me who's serious about actually addressing the affordability of health care. Democrats may talk about helping Americans, but their bill is nothing more than a political messaging exercise that they hope they can use against Republicans next November. And so I hope that after today, they'll feel like they've checked the messaging box and will get serious about actually doing something about the spiraling health care costs under Obamacare. Republicans are ready to get to work, Mr. President. I'm not sure.
Okay, just heard there from Senate Majority Leader Republican John Thune talking about their plan that they are introducing and why they believe the current status of those Affordable Care Act tax subsidies are flawed by his words. Now, again, we're looking at two different versions of a bill going to the Senate floor today when it comes to your health care, and it's all circling around the conversation of those tax credits. From the Democratic side, they want to extend those credits that are set to expire by the end of the year. But on the Republican side, their bill looks to end those tax credits, and they want to take extra money and put it into some health savings accounts for people who use the ACA platform. They say that that will help pay for out-of-pocket costs, okay? So the big thing also to keep in mind, at this point, neither bill is expected to meet that 60-vote threshold. So where this conversation goes from here, we still do not know when it comes to the impact of today's conversations on healthcare. But what we do know from various studies, including from KFF, that there are people who could stand to have a significant jump in their healthcare payments, their premiums, if these tax credits expire, as they are expected to in a few weeks, if the lawmakers are not able to reach some type of deal. And also keep in mind, this is the very reason, in large part, why we were in that record-breaking government shutdown. One of the concessions out of that, Republicans said that they would promise that we would have a vote. That's what brings us to today. They're having a conversation, and it looks like they are going to have this vote when it comes to the healthcare tax credits. But right now, does not look like either of these bills are going to pass. We'll see what happens, as we're expecting that in the coming hours today. But one of the people who is obviously pushing on the Democratic side for the extension of those healthcare tax credits would be Senator Tim Kaine, the Democrat from right here in Virginia. He just released a statement moments ago. I'm going to read a bit about it in support of the 3-year extension of those premium tax credits. He said later today, the Senate will vote on simple legislation to extend Affordable Care Act premium tax credits and prevent healthcare costs from skyrocketing for millions of Americans and nearly 400,000 Virginians. He says he's heard from countless constituents about the difference this extension would make for their families who are already struggling with high prices above everything else, from food to housing and energy. He says the floodlights will be on my Republican colleagues who know that the American people, 78% of whom support extending these tax credits, expect them to vote for this legislation. Now, if they don't, he says they could very well be replaced at the ballot box by someone who will. Again, that's Democrat Tim Kaine right here from Virginia. He is referencing data points put forth. I mentioned KFF, the Kaiser Family Foundation, which looks into healthcare research across the nation. A survey found that a majority of the public said they did want the extension of those tax credits.